As the country continues to grapple with a medical personnel shortage, new data suggests thousands of doctors and nurses in Canada are going south of the border to practice. New research from secondstreet.org finds that U.S. border states issued nurse and physician licenses to nearly 10,000 healthcare workers with Canadian mailing addresses. Now, this, according to Second Street President Colin Craig, is roughly half the size of an NHL-sized arena full of staff. Meanwhile, federal data indicates that Canada is on track to be short some 40,000 doctors by 2028. Well, joining us now to unpack these findings is Colin Craig himself. Sir, welcome back to Forum Daily.
Thanks for having me.
So, nearly 10,000 medical personnel were found to have U.S. licenses. So, what exactly does this mean, Mr. Craig? Do all of these individuals make the commute south of the border to work?
No, and the short answer is we don't know exactly how many because it's difficult to figure out exactly how many. What I can tell you is that in the case of nurses working in the state of Michigan, we were able to actually come up with a pretty accurate number there because we were able to survey the nurses and ask, "What's your situation?" And there we found about two-thirds of them actually do make the commute across the border, and you can understand why with a large population of people in Ontario near that Michigan border, it's easy to make that drive over the border regularly. But what I would note is that just because someone doesn't actually commute to the US for work doesn't mean that they're not considering it. And that's something that we've heard from different healthcare staff is that maybe they haven't made that switch to go and work in the US yet, but it's certainly on their minds if they've gone through the process of trying to get a license in the United States.
And out of this demographic, what do we know so far about how many individuals were doctors and how many of them were nurses?
I think it was roughly about three quarters were nurses, about a quarter doctors, if I recall the stats correctly. It's predominantly nurses, but what we do need to keep in mind is that, first of all, these are only border states. There's certainly a lot of other states south of the border that have been attracting Canadian healthcare workers: California, Arizona, Texas, Florida, and so forth. So we need to keep that in mind. The second thing is that these are only cases where people have provided a Canadian mailing addresses. Some of these workers just outright move to the United States and they no longer use a Canadian mailing address, so they wouldn't be part of these numbers. But we think this is part of the solution to addressing gaps in the healthcare labor force. It's not going to address the entire problem, but it's something that governments can be thinking about is how they can recruit some of these workers. But also, we're seeing in Canada a lot of private clinics that governments are partnering with. So those private clinics might be able to offer these workers the type of work environment that clearly government health facilities haven't been able to provide.
All right, Mr. Craig, for some further perspective, what is it about the United States medical system that makes it so appealing?
That's a good question. I think maybe part of it is the variety. There's more different types of employers there, whereas in Canada, it's still largely a government monopoly. So you have the government dictating the terms of employment. And when we surveyed nurses who do work in the United States, they told us there was a variety of reasons why they chose there. One was availability of work. A lot of them told us that they were looking for full-time employment, whereas in Canada they were offered part-time, and they had sort of more of an erratic schedule. So, if they could work in the US, have a full-time schedule, predictable hours, I mean, that's something that a lot of people want. So that was the number one factor, was that availability of work. Compensation was part of this. It was right neck and neck in second place with working conditions. So it's not just about money. I mean, that's part of it, but there's other things that employers in Canada, whether they're the public sector or private sector health providers, things that they can do to try and address why these workers are choosing the U.S.
All right, and on that note, Mr. Craig, just a quick 45 seconds left here, but what kind of steps could Canadian institutions take to secure our own doctors and nurses?
Well, I think first of all, you can try to prevent some of the existing workers from leaving. So sit down, talk with them, figure out what they love about the workplace, things that they don't like, and maybe figure out if there's things that can change there. I think in some cases, the government employee unions can be a little bit more flexible to help facilitate some of these changes. And certainly in the private sector, they can reach out to these workers, call them, email them, whatever it is, mail them, and see if maybe they might be interested in working in Canada under sort of different work type arrangements.
Clearly a problem that needs to be addressed. Mr. Craig, thank you again for your time today.
Well, thanks for having me.